going to go ahead and get started because I have a lot of stuff to cover. Thank you for allowing me to come to Grand Rounds and talk about the resources for the library that are specialized for internal medicine. The first thing that I want to talk about is some research that's been done on how information is used. So first of all, disclosure, blah, blah, blah. All the photos are not mine. They're owned by somebody else. Okay, so an identified need is that the medical literature has established that physicians do not pursue their clinical questions all the time. So what we want to do is provide you with a quick, easy way to find the information that you do need in order to minimize the number of questions that you do not pursue. Okay? So we want you to pursue more of the answers, and so we want to provide that information quickly. There's also a need for you to be aware of all of the different services that we now provide because we've changed a lot of different things now. So, clinical information queries. On average, a physician may have about 1 to 5 clinical queries on a patient. Typically, that may be just looking up a drug dosage in a handbook that he may have or she may have, or any of the other types of things. So we know that they have lots of, the data that's been collected by other physicians shows that there are a lot of clinical queries. The question is then, do most physicians look it up? Unfortunately, literature shows that typically physicians don't pursue around 50% of the questions that they have in a clinical encounter. Now, I don't know about you, but I don't want my physician to know 50% of what's going on with me. So, and this is all of a lot of data. The reasons why are basically because the physician doubts the answer exists. Now, no one's written about this. I doubt this exists. The other is, I'm not even going to deal with this. I'm just going to send it on to somebody else, so they refer the patient. The next thing is they have a lack of time. Once again, we're getting back to the time and quickly finding information. The question is important enough to justify spending some time, and there's an uncertainty about where to look. So what is most disturbing in a lot of these studies that have been done on physicians is that, especially in this study, 28% of the questions were found, the answers were found. That means that a lot of times no one could find the answer to their questions. Okay? So, before you say that was family medicine or it's old data before the internet, we have information from family medicine and pediatric physicians. 28% didn't even bother to look up answers. Graber in the emergency department found that 19% internal medicine admissions were based on non-experimental evidence or no evidence at all when they were admitted. And finally, at Johns Hopkins Intensive Care, this is the one that I think scared me the most. In a 2-day period, 38% of the clinical questions that they had over that time period never got answered. So these are questions directly about patients that were in critical care beds, and they never looked up the answers. Okay? So to sum it up, he did a systematic review of all of this different literature, and he found that 50% of the time they only pursue answers, so 50% of the time no one even bothers to look for answers. And when they do look for answers, but it's only about 20% of the time they can't find the answers, okay? So should you phone a friend? Now, having been on the wards and having walked through, I know that the curbside consult, oh, just give ID a call, or just give cardiology a call, is a very frequent phrase used. So Cook and his colleagues, after conducting a study on barriers to answer clinical questions, this was done in 2013, so up to date, everything else is there. They suggested that questions may be best answered through discussion with a colleague. Efforts to improve curbside consultations could reduce costs and enhance patient care. That sounds so good. However, the real picture is a little different. Koo and his colleagues found that specialists felt that they often had inadequate information when they were talking with internists and family medicine physicians. And then Keating and her colleagues collected data that actually said that they were very concerned about the consultations affecting the quality of patient care. And then Olick and Burgess, they talked about the liability of consults and that the primary care physician, the internal medicine doc, the pediatrician, when they consult a specialist, are often still left with the legal liability because they can't necessarily claim that that consult had any patient-physician relationship. And then 2013, this was in the Journal of Hospital Medicine, so it's the hospitalist internal medicine journal, said that the risk associated with the practice of informal curbside consult is substantial. So, plus, we all know that one attending who, if you ever say, the fellow said, instead of the evidence says, you're going to end up getting throttled. Wow, I really thought this would get me more chuckles than this. I've heard her go off on people, so that's what it is. So how do you find information fast? You can call me, email me, or if you want to do it on your own, we do have the library and all of its electronic resources. So I'm going to talk about those now. So the thing that is new is that we have a system called LibGuides now. LibGuides is a way of organizing information into different portals or different sections. So let's look at the LibGuides. Very easy to use. There is an internal medicine LibGuide. And if you want to do anything, you want to bookmark this URL. This will get you everywhere and everything. This is the one that's the key to the kingdom, we'll say. Okay? So let's talk about the different parts of this. So additional resources, which is on the left here. Additional resources has a library catalog, the complete ebook list, the journal e-list, databases, the evidence-based medicine portal, and then your off-campus access, VPN. Because if you want to get to any of these resources off campus, you have to go through the VPN. Citation help, that's just general citation formats. New ebooks. So when we get new books or updated editions of books, I update this. So we just got Fairies, and now we have Sanford Guide to antimicrobial therapy. Geez, I can't talk today. We also have news. So we have a new reference librarian, Lexi. We also have other resources, sometimes we'll have listed there. And then at the very top, we have all of these tabs. The tabs are going to be the thing that are most important to you when you're looking for information fast. There is a tab that specifically says Fast Clinical Tools. So under that, we have ACP Smart Medicine, which is American College of Physicians, Cochrane Library, DeGowan's Diagnostic Examination, Diagnosaurus, which is a differential diagnosis tool, which is excellent to use, Dynamed, EKG, Plain and Simple, Ferries again, guide to laboratory and diagnostic tests. And then Harrison's fluid, electrolyte, and acid balance, because what is every question, it seems like? It all has to do with fluids and electrolytes and acid base. PubMed, Schwartz, if you have to refer a patient for surgery. And then the U.S. Preventative Services Task Force and UpToDate. Obviously, UpToDate is probably going to be the thing you're going to use the most. Ebooks. Now, I have pulled out from the collection selected ebooks that are fast reference tools. So the 5-minute clinical consult, the clinician's pocket reference, Kahn's current therapy, current diagnosis of treatment in geriatrics, because what do we see in internal medicine a lot? Geriatric patients. Current medical diagnosis and treatment, which was just updated a week ago. That was brand new. They just put the new edition up. Differential diagnosis, essential clinical procedures, and then first aid for the internal medicine board review. So if you're a resident, you might want to make sure that you check that out in the future. Harrison's ICU book, Medical Secrets, Merck, Principles and Practices of Hospital Medicine, Mechanical Ventilation, and then the USMLE images for the boards. So those are both resources that can be used for studying. E-journals, I'm not going to talk a lot about these. They're all internal medicine focused. So if you want CHEST or American Journal of Rheumatology or anything like that, they're not on this list. This is all just regular stuff as far as internal medicine. Selected databases. So we have a ton of databases. I think that that's one of the things that's the hardest, is the fact that we have so much information, especially when I'm talking to the medical students. A lot of times they don't know where to start when they're first years and they're trying to find answers to certain questions. So let me make suggestions on how many of you have gotten the morning report emails. Okay, you get those. A lot of times the ones that we use to find the information the most are Access Medicine and ClinicalKey. We could pull information from UpToDate or Dynamed, but we figured that you guys could do that on your own. What we're doing is we're trying to get to the literature that fills in a little bit more information. So Access Medicine and ClinicalKey are two really good databases. We do have the medical letter on drugs and therapeutics. We have their adverse drug interactions in there. We also have the dietary supplement labels database, and the medical letter on drugs and therapeutics itself I have listed here. Pillbox, which you can actually use to identify a drug. PubMed, StatRef. StatRef is another database of a whole bunch of textbooks. Tons and tons of textbooks. ToxLine, ToxNet, and then UpToDate. Okay, so Access Medicine. A couple of things I want to point out to you. Access Medicine has this bar up here at the top that allows you to find resources. And most of that, it's pretty self-explanatory. But I want to bring to your attention the videos by category. The videos by category will show you bedside and office-based procedures. You'll actually get to watch the video. So if you are going to be doing something, you could come in to see if they have the video. So say you wanted to look for something on lumbar puncture, you could go to Neurologic. It tells you how to, what position they have this video on, and then you can actually watch the entire video. Now, say you just want to remember how to measure opening pressure. You don't need all that other stuff. You can just go click right on that section and it'll take you to that section of the video. So it's fairly nice as far as how you can use it. The other thing that's very interesting about Access Medicine is the fact that it has self-assessment tools. So you can log in, register first, then log in, And you can have self-assessments done. You can test yourself on a wide variety of different topics. So the different topics can be either by topic or by a book. And one of the books that they have, if you go down, these are all the self-assessment books, is Harrison's Principles, and it's a self-assessment and board review. So keep that in mind. Once again, if you're a resident, especially a third year, you're prepping for thinking about the boards, it's the time to think about starting to look through those. You can do assessments and it will track. One of the nice things about the assessments is if you get something wrong, it tells you why and what the right answer is. So it's an excellent learning tool in that regard. ClinicalKey does the same thing. Now, ClinicalKey is a database that none of us as librarians wanted. It's one of those things where we wanted, the Hyundai Accent, which is what I drive, and they said, no, you have to have the Lexus, and made us pay for that. So ClinicalKey, basically the vendor, the publisher said, we're putting all this stuff together in one pot, and you have to pay this at very high price. And we were like, we could buy like 5 things or buy the whole pot and pay the same price. That's how they set it up. So we went for the whole pot. So it has it has 1,100 textbooks in it. It is huge. It's got journals, over 600 full-text journals in here. It also has something called Procedures Consult. Has anyone ever heard of that? Okay, Procedures Consult is any procedure you've ever thought about. It's listed in there, and it has the information on how to do it, and sometimes it has a video. So it's like step by step, these are the contraindications you should look for, this is the procedure steps you should do, all of these things. So it's very, very easy. If you know you're doing a specific type of procedure, you can just type in part of the word, or type it all in and hit the search button, or click on the link, and it'll pull up. And so this is Procedures Consult. My complaint about it is how it displays. It doesn't display very nicely. It's kind of clunky. That's what happens when you shove a whole bunch of stuff into one thing without a good interface. So you can go click on it. It'll come up with lumbar, and you will be able to identify what are the Procedures Consult because it should be right there. It'll tell you right at the top. And then you can actually go in, you can watch a video on it, or you can see the different sections. This is like in the middle of all of the different steps. It'll tell you very specifically what you're supposed to look for, landmarks and other things when you're looking for the procedures. Now, selected guidelines. The selected guidelines that I have listed up here are guidelines that are sort of the major ones that a lot of times get used. So the American College of Chest Physicians, they have all the anticoagulation guidelines. So that's what's linked up here. We have all of the different specialties that are linked as well. And the advantage of all of these is that they're in one spot. Sometimes you have to go to a website that's the organization's website, and you have to figure out where they put the guidelines and all of this other stuff. Here you can get right to it, so if you need to find the American College of Gastroenterology guidelines, you can find it, okay? And then this is just more of the list. I do have the National Comprehensive Cancer Network guidelines. These are not the ones that are used by the hematology oncology, but theirs are paid for and they're proprietary, so we don't have access to them that we can make available to the world, but NCCN does provide theirs free. You do have to register, but you can get in and look at them, and they're excellent, excellent. If is anybody interested in hematology here? Wow. No one? Hematology. Oh. Well, anyway, if you were interested, you could go in and look at them, and they're very, very nice algorithms, diagnostic points, so those are good guidelines to have. Now, do you need something more in depth? Do you want something that's a little more specific to a specialty? Then you can go in, and on the tab up there, I have all of the different specialties that are part of internal medicine. And I have tabs for them. And when you go to those tabs, it gives you the new books in their area. It gives you selected ebooks. The fast clinical tools are the same across everything, okay? It has their selected journals, selected databases, and things like that. So each of these individual sections have the most valuable resources for that section. Now, library services. So we have a lot of library services. We have Ask a Librarian. You click that link, it gives you an email. You click that, you can send us an email. It comes to the reference desk email, and one of us will answer it. You can also call us. We're very friendly. You can come in and see us. We're a friendly bunch. We don't bite. We do have classes. I teach EndNote. So if you are planning on doing any writing and you want to use a bibliographic citation manager to keep track of your citations, there's nothing worse than getting halfway through or a quarter way through writing something and then somebody say, I think you should take this citation out. And suddenly you have to renumber all of your citations. EndNote will do it magically for you. It's a wonderful, wonderful system. It's fantastic. So if you'll see periodically in the at LSU a advertisement that I'm having a class. I'm having one in August, the end of this month. There's comments and suggestions, the department liaisons. I'm the liaison for internal medicine and all of the subspecialties underneath it. Iliad, let me talk about that. Interlibrary Loan. We have so much stuff, but every once in a while, there comes along a case that we don't have the journal. It's in a journal that's either something foreign, or it's a journal that's very esoteric and we don't carry that. And consequently, if you're working on a case or writing a case report, you're going to want to get a copy of that. That's where Interlibrary Loan comes in. You can order through Interlibrary Loan. You register, you order. There are fees involved, but it's not that we're charging. We only charge back what is charged to us by the other libraries. We never charge anything on our own. We're just recouping our costs. Sometimes departments pay for that, other times they don't. The medical school does pay for it for the medical students. It's part of their tuition. The writing consultants. How many of you have heard about the writing consultants? Oh, come on. I know that the students need to know about the writing consultants because we bash it into your heads. The writing consultants are several librarians that have masters in English as well as degrees in library science, and they will go through and edit your paper and look at it for grammar, clarity, whether or not you're meeting guidelines as far as what the paper says. They will do all of that. They do not look at content because they're not content specialists. That's where your colleagues come in. But they will do everything else. So if you're writing a grant and it has a whole detailed list of everything that needs to be in that grant, they will go through and make sure that you have everything that needs to be in there. And you will be amazed at the number of times they get a grant that everybody thinks is done and they're missing something. And if you miss anything, especially with federal grants, it's immediately added in the pile. It doesn't matter how great your idea is. If you don't have something crossed, the T crossed or the I dotted, it's gone. They have a turnaround of about 4 days. but typically it's like 2, even less sometimes, depending on what it is. They will sit with you if you want to learn more about what they look for and have consultation times with you so you can set up appointments. They will do everything from research articles to poster, text, personal statements, resumes, CVs, grant proposals. They'll do everything. They'll even do department reports. If you're writing a department report or department publications, say you do an annual report or something like that, then they will help with that as well. The only thing they will not do is anything that's like, they won't do a full dissertation, because part of the process of doing a dissertation is finding and paying for someone to edit that. And we got yelled at by the basic science department for helping too many people with their dissertations. I don't know why. I would think that they would want us to do it, but they didn't want us to do it. So all you have to do, they have a specific email. You email it, you tell them when you want it, and they will send it back to you with changes tracked in the item, and then you can go through and look at them. So we have 5 librarians that what I would call reference experts. So there's myself, the clinical medical librarian. There's Talisha Tarver. She's the one that's in charge of the writing consultants. There's Lexi Brackett, who's brand new. There's David Duggar, who is our liaison librarian, used to be reference librarian. Lexi just took his place. And Monty Dobbins, who is behind the circulation desk, and as she says, in charge of the candy, but she's much, much smarter than that. She's very, very smart. So any of us can help as far as if you need finding information or looking for something. So that's one of the advantages of coming to the library, is we can help you any of that way. For me, I monitor my email most of the time around the clock, because I do get clinical questions at 9:30 at night. And I get clinical questions at 3 o'clock in the afternoon on a Saturday and a Sunday. Sometimes, just because I'm on the weekend doesn't mean that I stop. And as a clinical medical librarian, that's my commitment to the organization. So I check my email, and if somebody has an issue, somebody had something just this past Sunday, I did the quick search, sent them back, and they were like, thank you, thank you, thank you. That's what I'm here to do. So if you need help, quick help, don't hesitate to contact us. That's what we're here for. If you want to learn more about using these databases, so that when you, especially if you're a resident and you're going to go out into regular practice, and you may not have all of these bells and whistles. Not everybody gets up to date. They may get something else. You need to be exposing yourself to these different resources so that when you get there, you're not going to have a learning curve. Every time, try to use something different if you can. All right? Does anybody have any questions? See, I kept it short, sort of. Does anybody have any questions? Yes?
So with the ebooks,
yes.
Is there any way to get those pushed to a Kindle?
I'm sorry?
Any way to get the ebooks pushed to a Kindle? It's just hard reading on a computer screen, so I was just wondering about that.
Okay, the question is, can you get the ebooks pushed to a Kindle? Not with the Kindle software. If your Kindle is on the internet and can get on the VPN, then almost everything you can look at via there. Even the last one, the board review that I showed you, the I can't remember the name of it. One of those board review books, we used to not be able to use on an iPad because it had Flash, and they changed the software. So now you can use it on anything that has, Android software, which Kindle has. So my assumption is that you should be able to get to everything that is on there. I have tested quite a bit of the different things. The only thing I couldn't get around was the only thing that will not work, and I cannot get them to understand, is Tima's anatomy books. So that's one of the biggest problems I have with them. They only make it available for Kindle for individual purchases. So they want to keep their market of money. So we can't get those. But other than that, that's the big thing. Most of them should work. If they don't, then I need to know about it so I can complain to the publisher. Is that the only question?
Did you cover the apps? Because that ClinicalKey and Access Medicine, there are apps that
I did not. Thank you. I didn't even think about that. You may have noticed on a couple of these slides, let me go back. Sorry. Okay, so Dynamed has a mobile app that you can register for. If you sign up and register for this app on campus, you can use it without being on the VPN. You can be anywhere as long as you're on a Wi-Fi network. Also, ClinicalKey has the same thing, as well UpToDate has the same thing. Now, UpToDate and Dynamed require that you have to be on campus every 35 days or something to reassure them that you are a member of the organization. But after you register, you can use them without the VPN anywhere, as long as you're on Wi-Fi. Those are great resources to have on your mobile. I like Dynamed better on the mobile. Other people like UpToDate. I think UpToDate's kind of cluttered on the mobile for me. But Dynamed is very clean.
Access Medicine.
Access Medicine works as well. They have an app. Access Surgery has an app, as well as ClinicalKey. And the only one that doesn't really have an app is StatRef and the McGraw-Hill books. They just don't have an app. They just work on mobile devices. Okay? Any other questions? No. Well, thank you for your time.